Good afternoon, everybody, and a warm welcome to you all to our VOYCE Community Education Series. I do apologise if you were waiting for a second there. Do come in. My name is Jamie McGeechan. I'm the Events Coordinator here at VOYCE, and it's a privilege this afternoon to have Jan Keith, Director of Community Engagement for Ageing Ahead with us. Good afternoon, Jan. How are you this afternoon?
Good afternoon. I'm doing well. How about you, Jamie? So as Jamie said, I'm with Aging Ahead, which is an area agency on aging that serves the counties around St. Louis City. And there is another area agency on aging that is called, catchy as it is, St. Louis Area Agency on Aging. And that sister organization serves the residents that live in the actual city of St. Louis. So we thought for today's presentation, we would do a combination of those two agencies and share information on both while we're all in one audience. So I will be sharing information about Aging Ahead and also some about SLAY, as we call it, SLAY. All right. So the mission of Aging Ahead, very much like SLAY's mission, which is to support individuals through the journey of aging. Everyone goes through the journey in different ways. There are bumps along the road, curves and breakdowns and all kinds of things that can happen along the journey. And we just want people to know that we're here to support them no matter where they are on that journey. So Aging Ahead and SLAY are two of the 10 area agencies on aging in Missouri. We were all established in 1973 and serve individuals 60 years and older and their caregivers. Primary funding for all of our services is provided through a federal legislation called the Older Americans Act. And those funds are kind of trickle down to us through the Department of Health and Senior Services. And so we work very closely with that department. All right, so as I was saying, the area agencies on aging serve individuals 60 and older and their caregivers. And our primary funding comes through the Older Americans Act and funnels to us through the Department of Health and Senior Services. Aging Ahead serves individuals in the counties of St. Louis, St. Charles, Jefferson, and Franklin. And as I said before, SLAY serves residents of St. Louis City. Let's see. I want to make sure that we're still together. Jamie, are you still there?
I am indeed. I am indeed.
Okay, so we're good. Okay. All right. I'm sorry about that. The premise is not perhaps new to anyone that we live in an aging society, and by 2030, more than 70 million Americans will be 65 years and older. So that's an enormous number, and to illustrate that, it's that's twice the number that were 65 in the year 2000. So this is just some information that show the challenges and opportunities that we have before us, and that we need and partner with many organizations to help focus on developing new programs to be responsive to our individual communities and meet the needs of older adults and their caregivers in those areas. The Older Americans Act has been around even before area agencies and has kind of morphed into what it is today. There are several buckets of programs that we're mandated to provide, and I'll talk about those in just a second, but I thought you might find this interesting that we are actually prohibited from charging for any of our services, although we do accept donations. the goal is to really help people live in the community as long as possible, and then partner with other organizations when that is no longer an option. So we're lucky enough to work with VOYCE here in our service area to provide long-term care information and services that they do, and we're so grateful for that. So what's included in the Older Americans Act are many programs that you may have heard of. Those are access to information and referral, many times called information and assistance. Those are people calling into our offices to really get direct information on a variety of issues and questions that they may have related to their own aging or a loved one. So it's the information and assistance program or assistance and case management, care management, more direct, comprehensive help, if you will. A lot of transportation. The meals, probably our most famous program that we manage is Meals on Wheels, and Aging Ahead delivers just about 3,000 daily meals to homebound older adults in our service area, and SLAE also delivers those meals through their partner organizations. A lot of family caregiver support through respite, minor home modifications, all kinds of adaptive equipment assistance to help make sure not only the care receiver but the caregiver remain safe. A lot of disease prevention, healthy living programs in our programs, and then also throughout the community with our partner organizations. As I said before, Meals on Wheels is a very recognizable program that we serve. It serves as a portal for many other programs. So we always say it's more than a meal. So if a person is getting a meal, they are now connected to the agencies. If a volunteer delivers a meal and kind of notices something may be amiss or have some concerns about the person that they deliver the meal to in terms of health or safety, then they report that back to staff, and we're able to reach out and intervene and make sure that the individual has what they need to succeed. Most of our meals are delivered by volunteers. We do have some that are delivered by staff, but we're always looking for people to help us get those meals out. And they're all coordinated through the local senior center. So if you need help, I'll give you that information at the end, but you can go ahead and contact the closest senior center or just the agency, and they'll get you connected to that. Information and assistance services, probably, maybe more familiar to many of you as well. These are specialists that answer literally thousands of calls a month, just a whole host of issues that the individual or family may be facing. This is just a kind of a start to some of the topics that come up and that we're able to help give direction and resources for. If we do offer several programs in-house, as does SLAE, but we'll connect people to either our programs and many times to programs in the community. Choice is a program at Aging Ahead that kind of takes that concept of a senior center out into the community and presents that at libraries and grocery stores, YMCAs, community centers, other kind of places like that where older adults are naturally going. So we bring in the information, presentations, a lunch, those kind of things, and really kind of meet people where they are. It's a nice alternative to a senior center for people that might find that more appealing. Senior centers also a familiar term for many of us. At centers across our service areas, you can find all kinds of activities and chances to socialize and get together. And we all know how important that is now, more than ever, it feels like, after the 2.5 years we've just been through. Gives people a chance to connect with their communities and reap all those benefits. Many programs are still being offered virtually as well. So, we learned that we want to keep people engaged in person, and many times, like we are today, virtual is the best option. Community outreach, we do a lot of reaching out, making sure people in our communities know we're here. You may understand that many times an individual may not know about area agencies on aging until they are in a crisis situation or have had a situation that impacts their family and loved one. Something's changed. Maybe they've fallen, or there was a safety issue of some kind, a health issue, and now they need a little bit of help kind of finding the next step on their journey. So we do a lot of outreach to make sure people know we are here when they need us. There's lots of ways to get involved with both Aging Ahead and SLAE. As I said, delivering those meals, working on the advocacy end of it, which is also very important to try to make sure that legislators remember the importance of impactful policies for older adults. Keep making sure that all have opportunities to age well, and that they're supported in Jeff City. Primarily, we will do some federal advocacy, but primarily the silver-haired focus on Missouri policy and legislative action. Friendly callers, those are people that call individuals who may just be lonely. We want to help make sure that they're connected to someone that checks in on them and just is a friendly voice on the other end of the call. It can mean so much to the individual and to the caregiver. So to contact the agency in St. Louis City, this is information. Jamie will send all this out in an email if you're registered. This is how you would contact SLAE. And if you'd like to contact Aging Ahead, this is our information. We are located out in Manchester, kind of by Manchester and 141, but we have staff and centers throughout the service area. I'm going to try now to hope I can show this small video.
At Aging Ahead, we've been providing supportive services in St. Louis, St. Charles, Franklin, and Jefferson counties since 1973. Adults age 60 and older and their caregivers count on Aging Ahead to serve as a trusted source of services, programs, and resources that ensure all have opportunities to age well. For more information on accessing our services or supporting our mission, please connect with us. We are here for you. We are Aging Ahead with you. Let's reimagine aging together.
has questions, but I'm more than happy to answer any questions. Let's see if we've got something in the chat. Oh, you're there. Okay, well, good. Thank you, Vera.
Absolutely. And so Aging Ahead operates the 21 senior centres across St. Louis, St. Charles, Franklin and Jefferson County. Do the needs differ in these different areas? Do the needs differ from area to area?
Yeah, and it's really amazing. Even in so we get together often with our counterparts in Missouri, and throughout the state, really, the needs are very different. And so we're always thankful when legislation through the Older Americans Act adds or increases our ability to be responsive to those needs. So, for example, transportation may be super important in one area, but people really struggle with more, prescription drug costs or some rent or affordable housing in another area. So by being able to be responsive to individual communities, it really helps us tailor our programming and the kind of services we provide to meet the needs of folks in those areas. So
absolutely. Yeah. And obviously things have been radically different over the last 2 years, but certainly Aging Ahead have continued to offer a wealth of information through the video database on the Aging Ahead website, where there's over 250 really informative websites providing great information for seniors and caregivers. That's an incredible library.
Yeah, we were very, very fortunate to be able to offer this library of videos through Adaptive Equipment and Caregiving Corner, which is another nonprofit, local, and it's operated by, I don't know if you've ever had a chance to meet with them, but they are speech and physical therapists, occupational therapists, and they understand how using adaptive equipment, you're often sent home from maybe a rehab stay or a hospital stay or something when you've had some kind of an injury or health change. And, they're like, oh, get a shower bench or, oh, get it, whatever it is. And most people don't know how to use those things safely. A bed guard, there's so many things that can really help not only the individuals, but the caregivers stay safe and healthy. And so we're really thankful to be able to have all those videos on our website. If you're on our home screen, you will see those there, and you can click on those, and they're they have them organized in a really helpful way, I think. So if you're going to get ready to maybe have hip surgery, you can go to there and see what kind of things do I need to be thinking about for myself or my loved one. They're all accessible for free again on our website, and yeah, I'm glad you mentioned that because it's very helpful.
Oh, it's an amazing resource, absolutely. And Aging Ahead provide a lot of support not only for seniors and caregivers, but throughout the community to other organisations providing support. How important do you think that interagency collaboration is?
I just think it's the key. Gone are the days when we can do things on our own. We need to partner not only with other nonprofits in the community and really kind of mesh what our individual expertise and areas of knowledge and skills are, so we don't have all the gaps, but it also gives us a more collective voice when we're advocating and trying to meet families' needs. It's so much better if we're talking to a family member and we know right away, okay, this is who you need to talk to at such and such an agency. We have a good rapport with them. People we serve trust us. People you serve trust you. So it really does benefit all of our participants if we're collaborating and putting our energies together to help people and raise the bar on the services we provide, and also raise awareness many times at a more policy level to make sure the voices of the people we serve aren't are still heard and given the respect they need, and so it's critical.
Absolutely. I know that we had a question there from Vera Jones asking if the PowerPoint slides will be made available to our attendees, and they certainly will. We'll send them over with the link to the recording. But yeah, I must say, just thank you for your unflappability with the technical issues at the beginning there, Jan. I apologize for that.
It happens. We've all been there. So yeah, we move ahead there. So I really appreciate the opportunity to talk to the group, and anything we can do to work together and help our communities, we're there for it, as well as partnering with other businesses and organizations that are interested in a collective concern for older adults. We're there for that too.
Absolutely. Yeah. We do have a question there from Laura Jones. And it asks, can I clarify, SLAY is for STL city residents and Aging Ahead focuses on STL county residents?
Correct. Yeah, and if you're not sure, you can give either one of us a call, and we'll help you get to the right spot. Yeah.
And another question. A thank you from Laura. How do people? A question from Lisa. Anything for St. Charles?
Yeah. So our service area includes St. Louis County, St. Charles County, Franklin County, and Jefferson County. So all of our services are offered in all those counties. And then St. Louis City is servicing their programs for St. Louis City residents. But yeah, we have 4 centers in St. Charles, lots of staff out there. As you know, it's a growing community. I actually live in St. Charles as well. So it's, we're proud of our activity and things we have going on out in St. Charles. So definitely check us out.
I was really impressed learning about the choice program offered by Aging Ahead, making it convenient for seniors and caregivers to access information as well as to socialise at a time where that's been really difficult over the past 2 years. I was wondering if you could expand a little bit on the choice program and how much that means to the service users.
Yeah, it's really kind of been a program that we're just so proud of and have won national awards for being very innovative. And again, just like Jamie said, we shouldn't be in the position where we're trying to force people to go somewhere else, but be open to, if you're already going to the Y, maybe you attend a program at the Y. We collaborate with, a couple different Ys now, and pre-pandemic, we were going full steam on that, but we're excited to be getting that back up and going again. But it gives people an opportunity to connect with us and each other in lots of different places. We have things at the Brentwood Community Center, St. Charles School District, Frike's Restaurant or grocery stores out in Franklin County, all kinds of different Lindenwood universities and East Central College. It's just kind of what it's called in our the state regulations that we are required to follow. They're called community focal points, and so that's what they are, and that's what centers are as well. So we're not interested in closing down all our centers, but as the population of people that go to those centers kind of keeps dwindling, we're looking at, okay, where are people going? Where can we connect? And it's the focal points, and it's also virtually. We know that especially in a caregiver role, it can be tough for people to get time away for what, maybe their own doctor appointment or a haircut or what have you, let alone to go to just a program where they might have, fun, but it'd be easier to do those kind of things if they can do them virtually. And we're certainly interested in helping them be able to have those programs.
Yeah, and the list is it's all accessible on the Aging Ahead website for the community outreach centres throughout the region. And I was wondering, in terms of people becoming involved as a volunteer, is that something that we can do?
Oh, absolutely. We just couldn't do it without volunteers. I mean, that's just the short and long of it right there. We pre-pandemic, we had hundreds of volunteers, and are now ramping that back up. We have about 125 active volunteers right now, and that will move up as we're able to get staff back up in some of our locations. We're still struggling with some of that, like everybody, and some food chain issues and food supply issues, all that. But if you're interested in volunteering, we've got a spot for you.
Absolutely. I can see we've got another question now from Laura Jones. I'm interested in in-home type services for a parent. Would it be best to call Aging Ahead? I don't see anything specific on the website.
Yeah, so really, to tell you the truth, if you live in St. Louis County or one of the counties that we serve, give us a call and ask to talk to someone in information and assistance. And the reason that we don't put tons and tons and tons of information on our website is because we want people to call us so we can really address all the things that might be going on. But we do have that family caregiver program, which again has some respite opportunities, some home repairs, ramps. Some people need the other adaptive equipment and some support, and connection to different support groups. And there's a whole plethora of things going on. So we want to make sure people call and are connected to our staff that might help them in more than just one way, I guess. So give us a call. We'll be happy to help you.
I think that makes all the difference when it is really person-centered. It's tailored to that person's individual needs.
Yeah. We had, I used to be in case management, and we had people call that would say, I need my dad needs to go in a nursing home. And the more I talk to him, I'm like, what's going on? Well, he just can't get to the grocery store and cook for himself anymore. So, kind of making a leap to what he saw as his only choice for his father was to go in a nursing home. If you can't do those things, we're able to kind of, show some other options and solutions that may have worked for him. And in many cases it did. So, and yeah, I saw that other question come through, I think. Yeah, there is, if you have a family member or loved one that lives outside of our service area, if you can either give us a call and we'll give you this information, or you can go to elderlocator.org, and that is a site that's managed through the Administration for Community Living. And so that's a federal program, and you can put in a zip code or different things, and it'll tell you the AAA, the Area Agency on Aging, that serves the location of who you need. Or you can give us a call and we'll help you figure it out.
Absolutely. And yeah, I was reading earlier on about the Senior Medicare Patrol, the fraud education, and obviously the last couple of years has unfortunately seen a significant rise in financial fraud, attempted financial fraud of seniors and their carers. And this Senior Medicare Patrol looks like an incredible service to help protect older people, providing education and support. I mean, I think that's so essential. So I must,
it really is.
That.
Yeah, it's a great program. I think, I know, again, when I started, more than 10 years ago and learned the amount of Medicare fraud that goes on in our country, holy smokes, you guys, it's massive. It's massive. So, The Senior Medicare Patrol is a very important program to try to help Medicare recipients, know what to look for, have a place to call and get questions answered if they kind of suspect something is amiss, with how to read their explanation of benefits report that or notice that they'll get, all those kind of things. It's important work, and it could solve so many problems that we have going on and need we have in our country if we could get that fraud under control. But yeah, there's fraud across the board, and we if you'll keep an eye on our website, we will post things that are kind of the more, I hate to say popular, but there are some that kind of pop up and tend to be in a little bit of a trend, depending on what's going on with the COVID cards. It was a whole big thing. I need to have this. We have staff all the time that hear from people who, I need a, I was called, my grandson's in jail somewhere. You've heard all these horror stories, but it happens. And I can tell you, my 92-year-old mother, she loves to think she can outsmart them. And she's just kind of ornery enough to think, well, I know who I'm on to them, well, they're very sophisticated and very predatory, and, did get her Medicare card. And so she had to, lower her head and call and report it and get a new card. But they're very, very sophisticated. And so we're very determined to keep that information out there for folks, to keep them safe and making good decisions. IRS will never call you. Social Security will never call you. Medicare will never call you. You'll get something in the mail. So important to remember some of those basics.
What do you find personally most rewarding about working with an organization as awesome as Aging Ahead, Jen?
For me, I can come to work every day, and as busy as we are, and so many things that we have going on, to really have the opportunity to make a difference in a person's life every day. And I mean, every day, there's something that happens that I know we've done to help someone. And that's very rewarding, and it keeps us striving to do more and more of what we do, and keep building, keep growing, keep being responsive, and reinventing ourselves and reimagining aging. It looks very different to age in 2022 than it did previous generations. And we're committed to staying with the times and doing all we can to help folks on that journey. You don't answer those calls. Hi, Clarence. I think I know you. Yeah, you can ask Clarence to be, if you're on the no call list with the Secretary of State's office, you can do that. Also, you can add a cell phone onto that. But if you're answering, they know you're a person. And so we always encourage people to try to refrain from answering calls that they don't recognize a number. And if they can leave a message, and if there's someone you need to get back in touch with, you're in control of that and can do that then. But the Secretary of State does have some tools. They're not 100%, but they can help. They can help with some of those unwanted calls.
Yeah, no, it's obviously a very unfortunate thing. It should never happen to anyone of any age, never mind seniors, obviously. But certainly anything we can do to prevent these unwanted contacts, all the better.
Oh, they're annoying, yes.
Please don't be shy if anyone has any questions for Jan.
That's some good ones so far.
Absolutely. it doesn't look like there are any more questions at the moment. What I will say is that at the end of the webinar, we will have a poll which will display on screen, a short survey. Please do share your feedback with us, and we'll be very grateful for that. We will send a recording of the webinar with the PowerPoint presentation slides to everyone just shortly, but we are so grateful to Jan Keith, Director of Community Engagement at Aging Ahead, for joining us this afternoon. Thank you. So our very next Community Education Series presentation is The Dilemma of Aging and Long-Term Care on Tuesday, August 23rd from 12 p.m. to 1 p.m. Chin Hung, Programme Director of VOYCE, will be presenting this session. Chin will be joined by family member Mary to discuss long-term care options and to examine some real-life scenarios that can happen to residents in long-term care and how their families can help address these situations. You can register just now through our website, voicestl.org, and we will send you a reminder about this session very soon. Once again, I would like to thank our lovely guest this afternoon, Jan Keith, Director of Community Engagement at Aging Ahead, for a really informative session and for your time. And it's been brilliant. Thank you so much, Jan.
Absolutely. Absolutely. Stay well, everyone.
Thank you.